And how's everyone today? Good, good. All right, as was mentioned is that I am videotaping this. I'm hoping to eventually put this on YouTube. So if you have questions and you don't want to be on YouTube, save them for the end, okay? If you don't mind your voice being on YouTube, well, you can ask in the middle, that's fine too. All righty. Oh, my thing keeps on blanking out here, doesn't it? All right, here we go. So, what we have here is we have a picture of a cute little girl, pink ribbons, like slides, the whole works. And this lady is called Ashlyn Blocker, and she is a very unique individual. She's a 1 in a million. And anybody who has kids says, but my kid is a 1 in a million. No, this kid is a 1 in a million. The reason why is because she has no fear. She has no fear because she has no pain. And of course then everyone says, well, how can that be a bad thing? And it can be a bad thing in that because she feels no pain, she can't feel things such as a burst appendix. She can't feel things such as broken bones. She can't feel pain. She also can't feel heat. So if the house happens to be burning down, you don't know, right? She also cannot smell, and so she can't smell smoke, for example. She can't smell if her food is bad. All right? So I just recently read a review of this lady, and in the headlines they said, young lady suffers from a disease that claims most by age 3. All right? So I put this young lady up because, you know, on the one side pain is a curse, but on the other side not having pain is also a curse. The good news is that this is Ashlyn Blocker now, 12 years old. She obviously has survived. She's doing quite well. Not only that, but she's also being a great individual in that she's putting her body up for science. Over here on the one side, they're researching her her condition, and then on the other side, she has started up although it's not coming through very clear, they've started up a support group for people who have this kind of illness. Okay. So pain. Come on, forward.
Can you turn the lights off, Opie?
Yeah, I don't know if we can. Can we turn the lights off? Up at the front here?
I'll play with
Is that a dimmer right there?
Turn them down
Oh.
at least.
What are these? Are these dimmers?
No, I think they're behind you.
No,
Let me
those
see
are
what
the volumes.
Let me see what I can do.
Yeah.
That didn't help much.
Nope. You
Those
leave those
these
ones
pots that we
out.
want.
Yeah.
Yes.
Ah, there we go.
There we go.
Ooh,
Is that enough?
nice.
I used to be a lighting designer.
All right. So let's see if we do this. All right. So I always like to put this little thing in. This is Walt Kelly, otherwise known as Pogo. An agnostic is someone who doesn't know. Die is the Greek prefix meaning to. Therefore, diagnostic is someone who doesn't know twice as much as an agnostic doesn't know. So part of the reason why I put this in here is because I deal with a lot of clients with pain. However, one of the things I do want to say is I want to say two things. One is I'm not an expert on MS. All right? The other thing is I'm not an expert on your pain. All right? I have some general guidelines on what I might be able to help you with, but you're the expert on your own pain. All right? And of course, I refer to pain as the sixth sense. We have our 5 senses, our vision, our taste, our hearing, what else we got? Our smell and our touch. And then I would suggest that pain is the 6th sense. And unfortunately, lots of people suffer with pain, with chronic pain. About a third of Canadians are suffering with chronic pain. I have some numbers that are a little different than Dr. Devonshire's, but basically in the same range. Lots of people with MS also experience chronic pain. Dr. Devonshire has already covered some of this. So what are some of the things that you might experience in MS pain? So we have a bunch of different things that may result as a result of MS. And then what happens is we have chronic pain can lead us into this downward spiral. And so we have here, we have your body, which is experiencing pain. That will affect your emotions, it will affect your behaviors, it will affect your thoughts, and the whole thing can spiral into this dark, deep morass. And so what we are offering, or what I am offering here, are psychological approaches to help you cope with your pain, all right? This is not a replacement to something like physical therapy or medicine or something like that, okay? This is the psychological approaches. This is a matter of, if you have a certain amount of pain and I can take away this much, and then perhaps exercise this much, and then perhaps medications this much, would that be worth it? And I always say, any less pain is worth it. So here's one way of describing it. Here's another way of describing the chronic pain cycle. You can see the increased pain, the anxiety, not coping, all these kinds of things. And then the other one, of course, we have the pain, and it affects all kinds of aspects of your life. So we have pain, we have a tendency of not wanting to move. Unfortunately, this causes problems. We also have things like unemployment, which affects money and these kinds of things, living standards. We have deconditioning, which can start to affect energy and these kinds of things. We have the fact that the people who are supposed to help, and probably every one of you has experienced doctors who just don't understand, family members who don't understand, friends who don't understand, somebody who doesn't understand, right? Family difficulties, withdrawal from society, depression, habituation to medications. Somebody had mentioned earlier about habituation to medications. We're primarily talking about the pain meds, the opioids, all right? So, it's not a fun place to go. I'll give you something for the pain. Alrighty. Okay. Is everyone hearing me back there okay? Yeah? Alrighty.
See the screen when you're in front of
I'm standing right in the way of the screen, aren't I? Is there any possibility you could switch over a seat so you can see the screen?
the half of the people behind me also don't see the screen.
Alright.
Gotta move away.
Unfortunately, if I move away, then I'm outside of the picture, then nobody sees me on the video.
Oh, I see.
I've actually set this up to be approximately in the right place. There are handouts. If you take a look at your package there are some handouts, and you can sort of follow along there, okay?
We see, and there's more chairs over here.
Okay.
Yeah, there's more chairs too, yeah. Alrighty, okay, so what happens when we have pain? So here's a picture of acute pain, somebody you know, sticking their finger with a thumbtack, and what happens is there are nerves that are triggered in the finger. This then sends a signal up the arm and up into the spine, which then goes up into the brain. The brain then interprets that signal and says, ouch, and it says, warning to self, don't step on thumbtacks in the future, okay? So what this picture is what we have here is we have in your brain and throughout your body as well, you have a bunch of nerve cells, all right? And they look a little bit like this. Big sort of tree with this big long root on it, all right? These are called the dendrites. This is where things go into the nerve cell. And then you have this big long root type thing. That's the axon, that's where the message goes out of the cell, all right? And so you have this message that goes from here down the axon, goes to the dendrites of the next one. And what you find is over in this one here is you find that the axon ends in this bulb. There is a space, and then there is sort of like a catcher's mitt on the other side, and you have these little, what are called neurochemicals that jump across the gap, okay? And these are the neurochemicals that we are typically trying to influence when we are taking things like antidepressants or some of the pain medications, okay? Some of. So this is what's happening here. And then we have demyelination in MS. And what happens is you have these little, for lack of better words, these little insulating cells that cover the axon, okay? And these little insulating cells, what happens is they start to degrade. When they start degrading, then the message starts degrading from one neuron to the next, all right? And that's what's causing a lot of problems. Then we get these distorted messages. So, what are these messages? And basically the messages are numerous. We are getting messages from all over the body, all right? So we have touch, which is things like pressure and vibration. We have temperature, hot, cold. We have kinesthetic sense, that's your sort of your sense of balance, this kind of thing, where you are in space. We have pain, we have your vision, your hearing, your balance, your smell, your taste. But the brain is also getting inputs from different areas of the brain as well, also looking at the context. So right now you guys are sitting here attempting to understand what a psychologist is going to say about pain management. And we have the social environment as well. What have you been taught, right, throughout your history about pain? So we have all these electrochemical messages running all over the place. A message, electrochemical messages running from my eyes that eventually run back into the brain, and this electrochemical message starts rolling around in my brain. So what is pain? All right? And pain is information carried in the nervous system. This information, though, is not pain. All right? What this information is it's an electrochemical signal. And what the brain attempts to do, because it's a very complex organ, is it attempts to interpret these electrochemical messages into making some form of sense, some form of meaning. All right? So just like you feel hunger, all right, it's an electrochemical message. Pain as well is an interpretation by your brain. So of course everyone right about now should be standing up in arms and saying, are you trying to say that my pain is all in my head? Are you trying to say that I can just think my pain away? Are you trying to say that I'm going crazy? And unfortunately, this is a message that you are going to hear over and over again. And my very emphatic answer is no. Your pain is very real. Your pain is very real. It is very real, and yet at the same time, we also have to look at it, all right? So here we have a little picture of, this is an acute pain, so this would be, say for instance, pricking your finger or stepping on a thumbtack or something like this. Here's the brain. You can't really see the rest of the brain in the background here. Here's migraine pain. The brain's pretty lit up there. Another thing that had been mentioned earlier was the fact that, and so I will put it this way, is that emotional pain and physical pain are somewhat the same thing, all right? So here we have a wonderful little study by Eisenberg and colleagues, and she took a look at social rejection, which is painful. When we are rejected by friends or family, or even somebody like our doctors, we're rejected by them, we're going to have pain, right? And then physical pain. And look what happens. Look at this area here, same area that I showed you earlier, right? And so our emotions are very tied into pain. And quite often when I talk, which is a different talk altogether, when I talk about depression, I talk about what's the end product, physical or emotional pain. It all comes down to this, okay? So, very emphatic no, your pain is very real. However, because it is messages in your brain, then that means then that perhaps sometimes our interpretations are malleable. Perhaps we can change our interpretations a little bit, okay? So some of the examples that I use are, what happens if you wear rose-colored glasses, right? And here the little cartoon is saying, I'm going to go watch the news. Do you know where my rose-colored glasses are? All right. So when you put rose-colored glasses, the world starts changing. If you put blue-colored glasses, the world changes again, right? Here's another one. Would you trust this man? And everyone goes, well, I don't know. How about now? Right? So, oh, you want me to go back? Let's try this. There we go. There he is. All right, would you trust this man? There we go. Right?
At least he's saying who he is.
Exactly. So, here again, this was a brain interpretation, right? Here's a brain interpretation. Our brain is interpreting a black and white photo here, and it's interpreting it as a face, and yet when we turn that picture around a little bit, we all of a sudden start turning it into words. These are interpretations. And so from a psychological point of view, what I'm trying to say is that perhaps our pain is malleable. Perhaps we can develop certain skills to help us change our pain a little bit, or at least, at the very least, to help us reduce our pain a little bit, okay? And that's basically what I try to help people with. Okay, I suffer from bad headaches, a sore back, and sometimes my whole body aches. What causes this, Dr. Zook? Well, I don't know. Could be a sudden change to the weather. He's got some arrows sticking in his back. All right, let me just skip forward in my notes. I basically know this stuff, but just in case, I always like to have my notes handy here. Okay. So, what can we do about pain? What might a psychologist say about how to handle pain? And so, I basically have what I call the A, B, C, D, E, Fs. I am going to change this, and I'm going to put a G in there, and I'll explain that when I come there. The A, B, C, D, E, Fs of pain management, and then there is also pacing. Now, from my point of view, but then again, that's my point of view, pacing is the most important skill that can be developed regarding chronic pain. Okay? So all too often when I see people who have chronic pain, typically this is what I see in how their day looks, or how, perhaps not necessarily their day, how their week looks, okay? And so we start over here, we start by increasing our activity up over here. And as we increase our activity, what happens is a little later on, not at the moment, a little later on, all of a sudden our pain starts rising. All right? And so then what do? Well, we start to decrease our activity, and then all of a sudden our pain is way up. And as we decrease our activity, well, then the pain starts falling, right? And so then when we've decreased our activity and the pain has started to go down, then we start feeling good, so we start increasing our activity, right? And as we increase our activity, what happens? Sometimes this can happen, the pain can follow up to a couple of days later. And you may have mowed the lawn on Monday, and it's Wednesday when you all of a sudden feel this pain. Sometimes that happens, right? And so this is what we call the activity pain yo-yo. And this is something that pacing is trying to get you away from. So what we're attempting to do is we're attempting to find something that will happen more in the middle here, all right? Something a little closer to a sense of balance. So you put out X amount of energy every day, and you also then don't experience huge fluctuations in your pain, all right? So what's pacing? No, it's not this. Oh dear, oh dear, oh dear. That's not pacing. What is pacing? So I use a little analogy here, and I ask people, have you guys seen the movie The Matrix? A few of you have? All right. So in the movie The Matrix, there is the trainer and there is the student, and the trainer's name is Morpheus. And he's training up his student, his name is Neo, and at one point he points out to Neo and he says, "This is what we are to the machines." And he holds up a copper-top battery, all right? And I like that analogy, and so that's what I use as an analogy towards pacing. And so basically I say that when a person is healthy, although this isn't entirely true, but it appears to be this way, when a person is healthy, you have a battery that lasts 16 hours. You're this go, go, go for 16 hours, and then we've depleted ourselves, and then we need to recharge that battery, right? So we call that recharge sleep. And generally we sleep for 8 hours, that recharges our batteries, and then the next day, we're that 16-hour battery again, we're ready to go, go, go again, right? That sounds wonderful. Here's the problem. Then all of a sudden something happens. And we get things like MS, we have things even like the flu, we have things like a car accident, something or other happens, and all of a sudden we don't have the 16-hour battery. We have something that looks like this. Now each of you is going to pick a different number as to what this battery looks like, all right? Again, I'm not trying to tell you what your pain looks like. I'm going to pick some arbitrary numbers, all right? So the arbitrary number I'm going to pick is, this was our 16-hour battery. I'm going to pick an arbitrary number and say, this is an 8-hour battery. So you got 8 hours of energy, here we go, 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 and then you crash. There's a problem with that. We live in a 16-hour day. How are you supposed to cope with that? Right? And that's where I come in and I say, that's where what we need to do is we want to try and learn pacing. All right? And what pacing entails is that what we want to attempt to do is we want to, over here, we want to work a little bit, then take a break. Then we work a little bit, we take a break. We work a little bit, we take a break. Work, break, work, break. Now what happens is that each time you take a break is that you are giving that battery a little recharge back again. Okay? And so, although the main recharge comes at night when you go to sleep, during the day you can also add little recharges. And so I, again, pick an arbitrary number. This may not be you, but I pick an arbitrary number and I'm going to say, then you have a battery that gives you 12 hours of energy. Okay? So then I ask the rhetorical question. And I say, if I take this battery away from you, right about there, if I take that battery away from you and all I give you is the choice of this one or this one, the rhetorical question is which one would you prefer to have? Duh. We'd rather have this one, right? And yes, that's a rhetorical question. Of course we would like to have a little more energy. Everybody would, right? Now, there are two problems with what I've described here in my little model of pacing. The first is, so I will ask, I will say, when you eat food, of the energy you take in, how much of it goes from here up and how much of it goes from here down? Right? And the numbers that I've heard, now there are various numbers, depends on which research you read, but there are various numbers that I read. But basically the numbers that I read are anywhere between 50 to 70% of the energy that you take in goes from here up. The rest of it goes down. So look, there's quite a bit of body here. It's only getting 50 to 70% or 50 to 30% of the energy that I take in. The rest goes here to my brain, right? The energy that the brain uses is a phenomenal amount of energy. And so when we talk about pacing, we're not just talking about pacing work. You are expending a huge amount of energy right now trying to understand what I am saying. It takes a huge amount of energy to try and understand what I'm saying right now. It's taking me an energy right now to try and formulate the words and spit them out to you, right? So it takes a huge amount of energy. So this is not about work management. This is about energy management. All right? Does that make sense? So we want to pace our work, but we also want to pace our heavy thinking. All right? So that's number one problem with this little model here, is we have to think about energy pacing, not just pacing our work. The number two thing that I say is, how long have you lived in that body before it started developing chronic pain? A long, long time, right? You've lived in that body for a long time before you develop chronic pain, and now all of a sudden I'm saying, sorry, you don't get this one anymore. You got to pick one of these two over here. What am I asking? Well, to some degree, what I am asking is I'm asking for a complete personality change. Take your brain out, stick a new one in. Patrick 2.0, right? Do you know how hard that is? So the thing that I want to try and get across here is that this is very hard to do, to really reformulate your life into trying to pace yourself, okay? It's not easy. All right, so, oh yes. I kept on going, I tried to stop, but I just kept on going and going and going. The AA support group. AA's battery support group. All right. So, we have pacing, we have the three approaches to activity, and we have the three approaches to relaxation. We have the first one, let's see, what do I call the first one? The first one is called wait until. And that's basically where I go, 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 and I am just pushing myself through the pain, and I keep on pushing, and I keep on pushing, and eventually I collapse, and I can't go no further, and of course then I need prolonged bed rest. Okay? That's one way that we can pace ourselves. Not a terribly efficient way. Another way to pace ourselves is what I would call the boom and bust version of pacing. And what this is that we expend a certain amount of energy until we start feeling the first twinges of pain. We use that pain as a signal to take a break. All right? So we take a little break, and then we start being active again. And again, then we use the pain as a signal to slow down. We take a little bit longer break. All right? Unfortunately, what happens is that progressively, the work becomes less, and the time spent down is more. Okay? So when we talk pacing, what are we talking about? What we are talking about is get a rough idea of where you're at right now. All right? And then start at about, give or take, start at about 80% of where you're at right now. Start below where you're at right now. Okay? Now, you know, really easy for me to spit this advice out. As I said earlier, this is very, very hard to try and actually implement it in your life, okay? The idea, though, is try to get a baseline. Where am I at? You know, approximately what can I not do? That gives you the baseline. Start at about 80% below that, all right? And what we want to do is we want to take, on a regular basis, we want to take our little relaxation breaks. So I have a client right now who she has extreme pain, and I said, well, tell you what, let's attempt, and just because we're searching for a baseline with her, I said, let's attempt this. Let's go and do 15 minutes of activity, and then take a 15-minute break. And then we'll go do 15 minutes of activity, take a 15-minute break, all right? Her battery is sitting at about a 2, all right? It depends. Some people, they might be able to push themselves for a whole hour, and then they take a 15-minute break. Again, this is a little bit of trial and error that you're working at, okay? So perhaps you're going for an hour, you take a 15-minute break, then you go for an hour, take a 15-minute break. And what we are doing is we're starting at below baseline, and then once we've gotten used to that 80%, and we do that for a week or two, then we go and we push ourselves, and we say, okay, I wonder what else I can do. And we push ourselves. Maybe we push ourselves up to 85% of what we can do. So we increase the amount of time that we spend energy in, right? So maybe instead of going for an hour and then 15-minute break, maybe we're going to go for an hour and 5 minutes, and then a 15-minute break. An hour and 5 minutes, 15-minute break. And then we take the next step up. Once we've basically gotten there and we're pretty comfortable there, and we might take it up another notch. And maybe now we'll go for an hour and 10 minutes, and then take a 15-minute break. Hour and 10, 15, that kind of thing, all right? And we slowly bump it up. And if we take this very slow, methodical approach, then ultimately what can happen is we can actually find that we can actually have more energy out of the deal. As I'm suggesting, is perhaps we can go from an 8 to a 12-hour battery, okay? Alrighty. So I think that's pretty well pacing in a nutshell there. So now we go on to something called acceptance. So to paraphrase the Buddhists, this isn't quite what they say, I'm paraphrasing what they're saying. To paraphrase the Buddhists, in life, pain is mandatory. Suffering, on the other hand, is optional. All right? And then, of course, we have the wonderful serenity prayer, which goes, grant me the serenity to accept the things that I cannot change, the courage to change those things that I can, and the wisdom to know the difference. Lots of you folks, I see you mouthing along, lots of you folks know that one, right? And this is talking about acceptance. Now, a lot of people, when they hear the word acceptance, they hear the word give up. And one of the things that I want to say is acceptance to me does not mean giving up. All right? What it means is appropriate expenditure of energy towards your life in the best way that you can possibly do it. All right? Incorporating the pacing and all these other things I'm going to provide you. And then expending a little bit of energy towards hope. Typically, though, what I see is when I first see a person who has chronic pain, what I see is they come into me and they say, Doc, you gotta fix me, right? Fortunately, I'm not a magician and I don't have any magic cures, not most of the time. I have a bunch of tools that I offer people, but I don't have any magic cures. And so when I don't cure them in the first session, what do? They're off to the next doc, they're off to the next specialist, etc., etc. And that's because they have all this is hope, right? All this is hope. And then, what are they doing with their life? This is life, right? And with acceptance, what we are trying to do is we're trying to reverse this. We are trying to say, live your life to the best that you can, but don't give up hope. We heard some very interesting news on some of the new medications coming out on MS today. I was like, wow, I was blown away. I don't know about you guys, but I was blown away. And got to keep the hope alive, right? Okay. So, acceptance means appropriate expenditure of energy towards your life, appropriate expenditure of energy towards hope. Never give up hope, but don't also give up your life. All right? The next one is, in the ABCDEs, B stands for breathing. One of the things that we find is that with breathing is that's what we find is really useful towards pain. Quite often people in pain, they have a tendency of breathing a little bit off, and so they either breathe like this, and they hold their breath because they're in so much pain, or they breathe in this very rapid, shallow way, which is like this, right? Neither of these is very conducive to reducing tension, stress, and pain. And so what we want to do is we want to start learning to take some time to breathe. All right? Breathing and relaxation. Now, one of the things that you have to be careful of is if by some slight chance you folks come to see me and you have MS, then one of the things you want to be aware of is that normally when I'm dealing with pain, I'm going to give you a relaxation CD. And one of the tracks on that relaxation CD is imagine yourself on a beach. And some people are so good at visualizing the beach that they can actually feel the warmth of the beach. How is that going to affect your MS pain? For some of you, it's going to make your pain go up, not down. Other people, they're going to lie on the beach and they're going to go, whoa, this is great, and their pain is going to go down. So in that case, then you would want to ask somebody like myself for either neutral or cooling imagery. Okay? So it's important to think about that with the breathing and the relaxation. Yeah, I think that's good enough for that one. All right, so here now under the ABCDEFs, we have C, which stands for cognition, which is your thinking. I'm actually going to split this one up into two, and I'm going to call this C, which is cognition, and then eventually I'm going to put one at the very end, and I'm going to call it G for goal setting. So what we have over on the left-hand side is a person with chronic pain and the way that they view the world. And I've seen this happen quite often, and I'll ask them, so tell me about your pain, and they'll say, oh, my pain is horrible, it's way up there, it's interfering with my sleep, it is preventing me from reading books, I can't concentrate long enough, I can't even focus long enough to read the newspaper, it's preventing me from playing hockey, it's preventing me from doing all these things. And then I'll ask them, and so what's good about your life? And they'll say, well, my wife, my kids. But then of course they'll say, and I can't pick up my kids, I can't play with my kids, and all this kind of stuff. And if you take a look at this point of view of the world, it's a pretty bleak point of view, right? Now it takes a little bit of work, yes. Unfortunately, I have no magic pills here. It takes a little bit of work, but let's see if we can reframe some of the things that you're thinking about, all right? Prior in your life, before pain, you are so busy going. Now all of a sudden, I have time to go visit some friends. I may not have a lot of energy to see the friends, but at least now I have the time to go visit friends, even for a short while, or even just to phone them, right? I remember still, this was quite a while ago, I had a hockey dad came in, and he said that he used to love playing hockey, and that his son also played hockey. And I asked him, do you ever watch your son play hockey? He says, no. We always play hockey at the same time. They were both fairly avid. And so one of the things in helping him reframe is, I said, well, you know something about hockey, don't you? He says, yeah, I've been playing it all my life. And I said, so I'm curious. You know, maybe we're just going to have to accept the fact that we can't play hockey, but might you make a really good coach for your son's team? Might you Also be your son's biggest fan. Your son doesn't normally see you at his hockey games. You know, if all of a sudden he sees dad saying, go, 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 you know, this kind of thing, this is a reframing. And so what we're doing is we're trying to reframe life in a way that we have more of these positives to help start to balance out some of these negatives. It doesn't take away the negatives. You're still having trouble sleeping. You still have a lot of pain. But we're starting to put more of these positives into life. Okay? Again, with the thinking, is thinking about what would you like to accomplish in life? You know, setting these goals. You have certain values in life. Okay? Moving towards those goals, those values that you have. That make sense? All right. I think that's good enough for that one. All right. What do we have here? My whole body aches. The other fellow says, I like it when that happens. You like it? At my age, I like it when my whole body does anything. All right. The D of the ABCDEFs is distraction, and distraction generally takes 3 different forms. For some people, the touch is going to, especially with MS and the certain features of MS pain is that sometimes the physical distraction is going to actually be painful. All right? Sometimes it is very comforting. You know, if I stub my toe on a rock or something like that, what do people typically do? They distract themselves by rubbing their toe, going ouch, right? And so you're distracting yourself there. What you end up doing by physically distracting yourself, if it's, you know, and again, there's the caveat, if it's not the MS pain, which causes more pain, you know, through clothing and that kind of thing. What it does, when I rub my toe, is, say for instance, if I try to get out this door, if we call me pain, and I'm just going alone, then here we go, right? But if I'm also having pain and rubbing my toe, then I'm getting somebody else to come along with me. I'm getting a signal of touch, pressure. And so now all of a sudden there's 2 or 3 of us trying to head out this door, all at the same time. How quick is the pain going to get through that door? A lot slower, right? And so physical distraction sometimes is very useful for pain, for chronic pain. So what do we have mentioned earlier was stretching, huge on that, massage, heat or ice. Again, it depends. For some people with MS, heat works okay. For some people with MS, wrong place to go, right? Instead, we want to go for cooling. Oops, come on back. TENS sometimes works, acupuncture sometimes works, sometimes things like Tiger Balm, you know, those kinds of ointments might work as well. All right? So that's physical distraction. The way we treat a headache here is to divert your attention to something else. How about social distraction? How does it feel when you are talking to other people, right? When we start engaging in these really engaging and meaningful conversations with friends, it has a tendency to distract us a little bit from our pain, and we start feeling a little bit better. So I suggest things like take the time out to reconnect with old friends. Take the time out to start making new friends. Take the time out to join a support group. Here we have a wonderful support group, right? And perhaps take the time out to help others who are in need as well. And then of course we have mental distraction. Wayne Dwyer, who has the wonderful little quote, and that is what you focus on expands. If you sit at home in your room and all you focus on is your pain, what's going to happen? It's going to get worse. So engage your brain in something that's going to distract you away from your pain. All right? If you can focus, things like crossword puzzles or Sudoku, hobbies, arts, crafts. I have something called the 5 senses grounding, which is utilizing all 5 senses. Pain is internal. Start turning those senses external. Start describing what you see. Start describing what you hear. Start describing what you feel. Start describing what you smell, what you taste, those kinds of things. That's the 5 senses grounding. Visualize yourself on a beach, or if you have MS pain where you're heat sensitivity, then perhaps walking on a nice, cool, rainy day like today might be useful. I don't know. Laughter. So laughter is one of those places where we release these endorphins. So watch some funny TV. You know, we go back to Norman Cousins, who cured himself of, I think it was cancer or something like that. It was some really bad disease. He cured himself. How did he do it? He went and rented a whole pile of old Marx Brothers and Three Stooges movies, and he locked himself in his home, and he just watched those all day long. And he laughed his way right through his disease. Now, do I recommend that as the only therapy? No. But it just shows you the power of laughter, right? So, distract yourself mentally away from the pain. What does a masochist do for a headache? I don't know. All right. The E of the ABCDEFs is exercise and stretching. Exercise, again, is one of these things that releases the endorphins. Endorphins are your brain's very own happy/pain-killing chemicals, all right? And you can have more of those by doing exercise or laughter. So it increases muscle strength, it increases flexibility, it increases blood supply, decreases inflammation, decreases muscle spasms, and decreases risk of re-injury. Food and water. These are things that you want to be aware of. These are sort of things that are on the outside, but sometimes can have a very large effect, right? With most people, not everybody, with most people, sugar is going to heighten your sensitivity to pain. So we have to be careful of these overly processed foods, right? There are other foods and chemicals that you might have a sensitivity to. When you're in normal health, you don't notice them. All of a sudden when you have pain, they all of a sudden become the pea that the princess slept on, right? Some foods and supplements help some people with their pain. There's being lots of study on fish oils, for example. I don't know, might help. And of course, water. Make sure you're properly hydrated, okay? So some other options, of course, the first one is make sleep a priority. That's a whole other presentation, so I won't be going there. Appropriate posture, preventing falls, all kinds of different things. Different drugs, physiotherapy, reducing caffeine, nicotine, alcohol, walkers, various things like that. All right, so I've given you some wonderful ideas here, but I want to try and point out something here, that despite the fact that I give you some wonderful ideas, and that is that pain, MS, is an invisible disease, right? So, again, I seem to go to Wayne Dwyer here, and he says, if you only believe what you see, then why do you pay your electricity bill? Right? You can't see your pain. You folks all look quite healthy, happy, etc., etc. I can't see your pain. And this happens that we get discriminated against when we have pain, right? So it's important to talk a little bit about the stigma of pain. Stigma, as Irving Goffman suggested way back when, stigma restricts a person's ability to develop his or her potential and therefore engagement in society. Everyone has worth. So there was a young lady who did a PhD dissertation, and she took a look at chronic pain and the perceptions of chronic pain. So her name was Patricia Reed. So here is some of the stigma of pain. What have we got? Other people think chronic pain is an excuse to get medications. 72%. Other people think that a person taking pain medications is a drug addict. 70%. Other people think having chronic pain is a sign of weakness. Almost 60%. This is what we're fighting against, right? Other people think that it's your fault, that your pain doesn't get better. What's that? Almost 60%. Right? Wow. It gets worse. Family members respect us less because of chronic pain. 35%. Doctors think that chronic pain patients exaggerate their symptoms. A little over 60%. Doctors think that chronic pain patients are drug addicts. Almost 50%. How scary is that, eh? Doctors prefer not to treat people with chronic pain conditions. Almost 50%. So this just goes to point out how important it is for you to join groups like this, to stand up en masse and to educate others about your invisible illness, all right? So what can we do? Advocate for yourself, identify stigmatization, so go to other people and say that's a stigma, that's not true, join a support group. Here we have a wonderful support group, assertiveness training, educate healthcare professionals. Quite often we end up having to go to the internet, get all this kind of information, go to our doctor and say, what do you think, right? Support groups that work towards political change and all these kinds of things, all right? So it's important that you band together, all right? I think, oh yes, there's a few resources here. As was mentioned earlier, it's just a brand new startup group. We're a year old. We're the People in Pain Network, and we've just started up a brand new group, and what we're trying to do is we're trying to establish pain support groups throughout, for starters, throughout the Lower Mainland, and then we're planning on extending our vision right across Canada. Included in your membership in People in Pain Network is that I have some downloadable tracks, some downloadable mindful tracks for chronic pain that some people might find useful. There's another one down here. That's at the very, whoops, sorry. Come on back. So that's People in Pain up here. All right, I'll get to your question in a minute, all right? And then if you want to get your own mindfulness CD, it was mentioned earlier, one of the books that I always suggest is this one. You're going to go, what does this have to do with me? And that is The Mindful Way Through Depression. One of the authors is John Kabat-Zinn, and in that book, you get a free CD. What a deal, right? The CD itself is worth 20 bucks, and you buy the book for 20 bucks, you're not paying for the CD, right? So it's a very good deal. I always like that one, but there's a bunch of other resources there as well. Okay, so I'm going to leave it at that. I'm going to turn my little thing off, and then if you guys have questions, we will go there. Is that okay?
It is, actually. I'm wondering if I could also ask you, we're running tight on time, and there's another speaker. We might ask these people if they wanted to talk to you directly for questions afterwards. If
I'm
that
okay
works.
with that, absolutely. Yeah, let me turn this off.
Thank you.